Dr. Darian Sutton is in for ABC Chief Medical Correspondent Dr. Jen Ashton as we track the major developments of the day. And we are keeping an eye on this big number. The CDC reporting that more than 7 million pediatric COVID-19 vaccines administered to children ages 5 to 11 show no notable safety concerns.
All right, Dr. Sutton, good to have you back. It's been a while. Hadn't been here with us on GMA3, starting to think you didn't like us. But it's good to see you, my man. As always, we got Omicron spreading, but help us here understand. Are we seeing that we see the number of cases going up? A lot of those still Delta, but are the rates of deaths and hospitalizations keeping up and in line with the rate of the positivity rate that we're seeing?
Great question. So good to see you too, TJ and Amy. I'm so happy to be back. Overall, the really important thing to remember, though, is that the Delta variant is still the primary threat in terms of risk of hospitalization and death, and overwhelmingly it's due to the unvaccinated patients, unfortunately. And when many people ask questions, how can I tell the difference between the Delta variant and the Omicron variant? It's really difficult to tell, honestly. A lot of the evidence is anecdotal, and so I try to advise patients, if you have any flu-like or cold-like symptoms, to act as if it's COVID-19 until proven otherwise. And then lastly, the main thing I'm concerned about, guys, is hospital capacity. Although we right now have not seen any increase or significant increase in the rates of hospitalizations, I literally just left the hospital. We are treating the flu, we are treating Delta variant and other respiratory illnesses that we commonly see in the winter. And I'm concerned that even a small increase in the rates of cases secondary to the Omicron variant might push us over the edge and strain hospitals beyond capacity. And that's what I'm trying to prevent.
Well, and Dr. Sutton, a lot of us trying to gather with each other for the holidays. Should we all be testing before we do so?
Great question, Amy. And you know, what I try to advise patients is that you always want to practice as many mitigation efforts as you possibly can. That, of course, includes making sure that you're vaccinated, and if you're eligible, getting boosted, wearing masks indoors, and choosing areas that have high levels of ventilation. And when it comes down to testing, it comes down to the two main forms of testing that we've all learned to love and understand. It's the PCR testing and the rapid antigen testing. Just want to help everyone understand, PCR testing is that gold standard. It's highly accurate, but it does have some setbacks. It takes sometimes 2 to 3 days to get that result, and sometimes it can simply not be accessible. And so it's not helpful when you're trying to get to that Christmas dinner. And that's where antigen testing comes in. Antigen testing is looking for those viral particles secondary to highly replicating virus. And although it's not 100% accurate, it's really helpful to use when you're trying to understand whether or not you're infectious. And the way that I advise patients to use it is to use it as close as possible to the event. I'm talking about within the hour before. Use that antigen test, and if it's negative, you can presume that you're not infectious. Heaven forbid you possibly are positive, but of course, combining all of these methods is probably your best bet at protecting everyone and keeping safe.
All right, Dr. Sutton, with always helpful information there. Thank you.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.